Hello. I'd like to talk about Barrett's esophagus. Barrett's is an important topic, actually. Barrett's is where the lining of your lower esophagus is replaced by tissue that shouldn't be there. It's replaced by what we call intestinal tissue. So it's a change in the tissue in your lower esophagus. Why is it important? Although the numbers are very small, there is a risk of cancer with this. So this is what we call potentially a precancerous condition. What are the risk factors for this? Usually we see it in patients with chronic reflux symptoms, but not always. You can have Barrett's with no symptoms of reflux as well. We see it more in males over the age of 50, in those that smoke, in patients who are obese, and in patients who have a hiatal hernia. In other words, all the factors that increase your risk of having reflux, although at the same time also increase your chances of developing Barrett's esophagus. So, symptoms of reflux with heartburn, chest discomfort, difficult swallowing, a chronic cough, and irritation in your throat are all symptoms of reflux, and at the same time, potential symptoms of Barrett's esophagus. So it is a potentially precancerous condition. How do we diagnose it? We see it, first of all, at the time of endoscopy. It's not something that we can diagnose by just talking with the patients. We see it at the time of endoscopy. But it is a histological diagnosis. In other words, we take biopsies from this tissue. We take multiple biopsies at different levels. And it is the pathologist that makes the final diagnosis. So we suspect it, and it's confirmed at the time of histology. How do we manage it? Well, first of all, we manage the reflux. So these patients need to stay away from fatty, greasy foods, not to smoke, not to take alcohol, not to eat very fast, not to eat late at night. Okay. Avoid foods that give them discomfort. And then we treat the reflux with medications if dietary manipulation doesn't help. So these are what we call proton pump inhibitors, or we can give medications that neutralize the acid in the stomach, or medications that increase the emptying of the stomach. All treatments, once again, for reflux disease. Now, if we find changes on the histology that what we call dysplasia, in other words, dysplasia is where the risk of cancer goes significantly up. It can be mild, it can be moderate, it can be severe. Depending on what we find, with findings of dysplasia, we can manage them mostly endoscopically. How? We can burn it, what we call argon therapy. We can do what we call a mucosectomy. In other words, remove that particular area that has these dysplastic changes. But if we're late with the diagnosis, then the patients will need a surgical intervention, which is rather major surgery. So the message here is this: take your reflux symptoms seriously. If it doesn't go away with lifestyle modification, talk to your physician, who most likely will be giving you medication for this. But if you cannot get off the medication, or if despite the medication your symptoms persist, then you will require a gastroscopic examination to evaluate your upper GI tract and to rule out Barrett's esophagus. If you do have any findings to suggest Barrett's, please, very important, you will require follow-up with this, with your physician, with not only your medications and your blood tests, but also there's an endoscopic surveillance program for this as well. Thank you.